It's a pleasure for me to be here to speak with you all today. I'm going to be speaking about gastrointestinal health, as Susan has said, and it's really a big topic and also one I see a lot of in my clinical practice. Just to give you a bit of an overview today, we're going to be talking for approximately an hour and going through some key concepts in gastrointestinal health. Just a little bit of an overview for you to get acquainted at what's coming, sort of a preview of coming attractions here, and we'll get right into it. So with respect to myself, I am a naturopathic doctor. I have a private practice in North Vancouver, British Columbia, Canada, and I've been in private practice for approximately 8 years now. I'm really enjoying myself, and I have a general practice, a large pediatric component to my practice, but a general practice. My youngest patient currently is about 4 months old, and my oldest patient is about 94, so really see a lot of varied individuals, patients in my practice, and lots of interesting cases. As Susan did allude to as well, I am an AOR medical advisor and the newest addition to the team. Really happy to be here, and the principal reason that I really became interested in AOR is that I've been using their products in my clinical practice for the past 8 years and have had really good clinical results with them. I'm sure you're all aware of AOR's reputation as a very good and well-researched company as far as their formulations are concerned, but what really drew them as far as I was concerned was that I really had good clinical results with using their products for my patients. As well, I am also what's called a DAN doctor, or I have a DAN certification, and that's something that's called Defeat Autism Now. It is a program and a certification out of the United States for dealing with learning challenged and autistic kids. So I see a lot of those in my practice, and I'll allude to some of the things specific about them just for information and further on in the talk here. In addition, I also have a certification in IMMH, which is Integrative Medicine for Mental Health. And funnily enough, there are a lot of digestive system concerns that do pertain particularly to mental health, and I'll allude to some of those during my talk today as well. So, with respect to some numbers around gastrointestinal illness, and just before I get into that, I just wanted to sort of preface this by saying that people go to the doctor for basically 4 reasons. They go because they're sick, they're tired, they're in pain, or they have a skin problem. It's basically encompassing all the sort of major reasons why people come and see a doctor. And gastrointestinal health is really tied to all of those, and I'll elucidate how that plays out in the talk here. But I really wanted to let you know that it's a very important system in the body. It's certainly the bread and butter of naturopathic medicine. There are a lot of gastrointestinal challenges with people all across the world, and certainly in our country, Canada, here as well. And just to really sort of get it on your radar that it is a really important system to pay particular attention to for health and well-being throughout the ages. So just to run through some numbers here, an estimated 20 million Canadians suffering from gastrointestinal illnesses, huge dollars spent with hospitalizations and lost productivity in the billions here. Over 30,000 Canadians die each year from GI-related illnesses, so big numbers. Funnily enough, and this was a surprise to me, in Canada we have the highest instances of gastrointestinal ulcers and irritable bowel disease, that's what IBD stands for, in the world. I found that a very amazing statistic, but obviously we have some significant challenges with our digestive systems as Canadians. A couple of other numbers to throw at you and some other stats. Medical diagnosis of gastrointestinal disease doubled over the last decade. So our guts are in worse shape, it seems, than they were a decade ago. With respect to cancers, and we're not going to get into cancer specifically today, but just so you're aware that gastrointestinal cancers are Canada's #2 killer besides lung cancers. An estimated 10 million Canadians with a particular infection of a microbe called H. pylori, Helicobacter pylori. We'll get into the specifics of that further in the talk here, but just again to sort of wrap your head around numbers, that's a large population infected with this microbe. Incidentally, it's the principal critter in all sort of conditions of the stomach and upper respiratory tract. 5 million Canadians with heartburn. Having to miss work, lost productivity, again in the billions. This is a very common condition that affects lots of individuals. So just a quick little view of the gastrointestinal system. Lots of tubing, lots of complex things going on there, and the ramifications and the fallout from digestion really play out in all systems of the body. First and foremost, we aren't the sum of our parts necessarily. We're really a collective whole, first and foremost. And every system talks to every other system in the body, and it's really important that we have some appreciation for that. And so what we put into our digestive systems really affects all systems in our body. So just wanted to get into some key concepts here before we move any further. And just in thinking about, first of all, before I get into this, I do see a lot of children in my practice, a lot of pediatrics. And for those of you that have children, for those of you that see children in your practices and or you're dealing with children in places where you're working, really to be aware that a healthy diet is such an important thing. And if we can model for children, our children, and you know, talk about it with caregivers, with those individuals that are running school programs, the importance of diet, so they get these concepts at an early age. If we can ingrain these things into them at a young age, they carry those traits with them and those habits with them long term, and it really stands them in good stead for a long and healthy life. So the father of modern medicine, Hippocrates, said, "Let your food be your medicine and your medicine be your food." Another way of saying that is, you are what you eat. So really remembering that dietary habits and dietary themes really need to be mindful. We can have wonderful supplements that we take to enhance all systems of the body, but really at the end of the day, a good dietary foundation needs to be the cornerstone. With respect to dietary themes, keeping it simple, keeping it clean, keeping it colorful. Again, real food, food that comes from the ground, food that comes from the trees, food that is real food. The grandmother test, I often say in other talks, is would your grandmother know what you're eating? If your grandmother looked at what was on your plate or what was in your hand, would she know what that food item was? So that's a good guideline. The other thing is the chemistry test. So if you're eating a food item, and particularly a food item out of a box, if you're looking at the ingredients on that list on the side of the box, and you need a chemistry degree to decipher what all of those ingredients are, it's probably not the best choice for you. You really want to keep with simple foods. The less packaged, the better. The more fresh, the better. One of the things that's often not talked about with respect to digestive system health is stress. Stress is a huge component to managing a healthy digestive system long term. And I want to just preview it here a little bit first, and then we'll get into it a little bit more in the slides to follow. But with respect to stress and stress management, as stress increases, digestive function decreases. So the more stressed we are, the worse our guts work. We can have a very healthy plate of food in front of us, and if we're in a mode of stress, if our to-do list in our mind is 100 things and we're eating on the go, our digestive systems are really compromised. So remembering that stress management, and certainly stress management around times of eating, is very important. I often say to people, you know, if you can take just a few moments, have a breath, say to yourself that your to-do list can wait, and whether that's also turning on some nice music or lighting some candles or opening a window, something to just get out of your head and onto your plate to allow yourself to enjoy your meal is really, really doing yourself a great service with digestive health. The French paradox is a study that was done a number of years ago now that showed that an average French person outlives an average North American person by about 12 to 15 years. And on average, they smoke more, they drink more, and they eat richer, fattier foods. And so basically the crux of the study showed that it was really the stress that was the issue, and that the French have a much more joie de vivre, joy of life philosophy than we do in the West. In the West, to eat is something on our to-do list during the day. It's not something that's necessarily enjoyed or savored. Often the European cultures get together with friends and family, they take their time, they share in their meals, and there's really some joy in that. Whereas in the West, we are often eating on the go, and it's just one more thing on our to-do list, and I think that does us a very big disservice. The other thing I wanted to mention, and at the previous slide with a picture of the digestive system, you saw that the digestive system really, first and foremost, starts in the mouth. And dental health is really an important thing to think about, and oral health is as well. So if you've got challenged teeth, if you've got infections in your mouth, all of the bacteria, microbes, infections, that really plays out in compromising your digestive system and your immune system. And remembering that 30% of digestion happens in our mouths with our saliva and our chewing processes. And many individuals are what I call two-bite and swallow people, and especially little boys or boys in general and men. We tend to eat our food very quickly, and we tend to take 2 bites and swallow it down. This really compromises digestive system long-term. So remembering the importance of good dental and oral health, and also having, you know, a good chewing session before swallowing food. So again, I said we were one of the keys to digestive system health long-term is management of stress. And I want to get into stress in the nervous system just a little bit here, fill in some gaps for you. So with respect to the nervous system, there's 2 sides of the nervous system. There's the stress side of the nervous system, which I'll talk about here in just a second, and the non-stress side of the nervous system. So you can think of this nervous system kind of like a teeter-totter. So it sort of moves up and down with respect to the stresses that we encounter during the day. And certainly, you know, stress management is something I see in my practice on pretty much a daily basis. And unfortunately, it's usually the mismanagement of stress that's brought people into the doctor's office. With respect to the stress side of the nervous system, or the sympathetic nervous system here, this is the fight or flight side of the nervous system. So this is that feeling that when we are stressed out, that maybe our palms get sweaty, maybe our heart rate starts to increase, maybe we're feeling some increased tension in our neck and our shoulders, maybe we're clenching our jaws, those kinds of things. It's really causing us to feel just tight and that sort of classic stressed out feeling. With respect to how that works on a physiological level, so we talked about heart rate increasing. What I really want to draw your attention to is the bullet second from the bottom there on this slide, showing that it causes decreased blood flow to the digestive tract, principally. So again, with the stress being high, digestive function is low, and one of the reasons that it's low is because the blood is taken away from the gut and not allowed to facilitate optimum digestion and circulation of nutrients. Also, long-term stress will impact your immune system and decrease your quality of sleep. Both of those 2 things, again, from a health perspective, are not good. So now looking to the non-stress side of the nervous system, or the parasympathetic side of the nervous system. It's the relaxation side of the nervous system. It's the non-stress side. It's where digestion should optimally occur. So this causes a lowering of the heart rate, and it causes increased blood flow to the digestive tract, allowing for optimum digestion assimilation due to that enhanced circulation. It helps with immune system function. It helps with sleep quality. It's really the sort of restorative reboot side of the nervous system that's very, very important there. And I didn't mention it on these slides, but also just to sort of draw your attention, the 2 main hormones with respect to nervous system balance in these 2 areas are adrenaline and cortisol. Adrenaline being the fight or flight, or the sympathetic hormone that comes out during times of stress, and cortisol, the sort of one that comes out afterwards, trying to clean up the mess that adrenaline has left, but also long-term with chronic stress can cause some real challenges with both digestive system integrity and health, as well as inflammation. So getting into some products that I like to use for managing stress, previewing them here. One I probably use the most of with respect to stress management is one called OrthoAdapt from AOR here. It's a combination glandular and adaptogen. And I didn't talk about the definition of adaptogen, but an adaptogen is a substance that basically helps to modulate the nervous system. It helps to facilitate managing the high stress, but also helping with chronic stress. And if the parasympathetic side, or that non-stress side of the nervous system, is under-functioning, it helps to bring that up. So basically balancing the teeter-totter, for lack of a better analogy there. So this formula contains some glandular extracts, which really help with facilitating building blocks for healthy adrenal tissues. And it also has a combination of these herbal adaptogens, which I'll get into specifics here as the talk unfolds. The Ganda 600 formula is from ashwagandha, which is an Ayurvedic medicinal, and really great for controlled. It's sort of a double effect here. Really great as an anti-ulcerative for the upper digestive tract, but also really helping to facilitate adrenal exhaustion or adrenal burnout. So sort of when stress is high, people get into something called what's called sympathetic dominance, which means that stress side of the nervous system is really on overdrive and has been on overdrive for a long time. And what happens is that the adrenal glands really start to burn out in their capacity and ability to secrete hormone and balance nervous system. So the ashwagandha and specifically the Ganda 600 formula really helps to facilitate balancing that out. Also helpful with respect to immune system boosting, as well as helping as a bit of an antimicrobial here to destroy infected tissues and foreign cells. With respect to rhodiola, again, a really great adaptogen, really great at balancing the levels of the stress hormones, but also the levels of neurotransmitters. I'm not sure if you guys are familiar with the term called the enteric nervous system, but the enteric nervous system is one that doesn't get a lot of play in the regular media. It's basically our gut-brain connection. And if you've ever had that feeling where you've had a gut feeling about something, that something's right or something is wrong, there's actually some chemical things going on there that are connecting what's going on at the level of the gut with the level of the brain. And funnily enough, a lot of the digestive chemistry and the brain chemistry are very similar in their chemical compositions. With respect to serotonin, for example, you've all heard of that hormone, I'm sure, in the brain helping with modulating depression. And serotonin is produced in large levels in the gut. So oftentimes when people have poor gut health, their serotonin level production in the gut is low, and that can contribute to what's going on with their mental health. So again, rhodiola really helpful with balancing both the stress hormones and the brain chemistry and having an anti-fatigue effect, so helping with energy. So some general clues that your guts are not happy. Again, these are probably obvious to most of you for most of these bullets here, some of them maybe not so much. So with respect to ulcers, stomach ulcers, again, really, really common in Canadians, and obviously clues that your digestive system is not happy. This is principally involved, stomach ulcer formation is principally involved in issues with stomach acid production as well as microbial growth, and we'll talk about the specifics of that in just a minute. GI reflux, or GERD, which stands for gastrointestinal reflux disease, the sort of common name for this is heartburn. Again, lots of individuals affected with that. With respect to gas and bloating and the sniff test, what I mean there is if you're producing gas that's uncomfortable, or maybe it's not uncomfortable but just embarrassing, the sniff test basically is if the gas is really stinky, that's an issue with protein digestion. If the gas is more like air, that's an issue with carbohydrate digestion. So just knowing what the gas smells like can also often give you clues as to what kind of challenges you're having with your digestive system. Bloating, again, often very, very common with digestive system challenges, and also where in the abdomen you're bloating. So if you're eating and bloating very quickly in the upper digestive area, that's an indication that things are not going well with respect to the stomach and the first part of the digestive small intestine, the duodenum. And with respect to bloating, if it's a little bit more delayed and is more central, sort of around your belly button area, sort of you're blowing up like a balloon, that is more indicative of a challenge directly in the small intestine. Diarrhea and constipation, obviously, certain key clues that there are challenges with respect to digestive health. Bowel frequency is something that I ask my patients every day when we're visiting together, and certainly on the initial consultations. So, diarrhea, obviously the food is moving through too quickly, and constipation, things aren't moving through quickly enough. With respect to bowel frequency, medical textbook says food in, food out, meaning that if you're having a meal you should have an evacuation sort of after that meal at some point down the line. So sort of if you're having 3 meals a day, approximately 3 bowel movements a day. For many individuals, that's not the case. I certainly like to facilitate and make sure that bowels are moving at least on a daily basis. So with respect to diarrhea, if things are moving through the body too quickly, things aren't getting absorbed well. The nutrients, the good beneficial chemistry and building blocks for healthy tissues throughout the body aren't getting into through the gut wall and into the bloodstream and off to their points of destination, moving through the body too quickly. With respect to constipation, it's a challenge that the stool is sitting in the bowels for too long periods of time, and now the toxins from the stool are being reabsorbed into the body, and the body has to manage that. So that's a challenge as well. With respect to IBD, IBS, that's irritable bowel disease or irritable bowel syndrome, again, lots of reasons why this is happening. Common ones are Crohn's and colitis for individuals. Again, a lot of challenges with digestive system integrity and certainly huge clues that your digestive system's unhappy. Skin concerns is probably not something you directly think about with respect to digestive system, but I really want to draw your attention to it is often a direct correlate, in my opinion, and certainly what I've seen in clinical practice. With respect to skin concerns and with respect to inflammation at the level of the skin, the body will use, and certainly the digestive system and the detoxification system will use the skin as a route of excretion very readily. It's our largest surface area, it's our largest organ, and if the body doesn't like something, it pushes it to the level of the skin very quickly. It's a very easy way for the body to deal with that. So inflammation at the level of the skin through eczema or psoriasis is really inflammation on the inside coming to the outside. And so you want to address why is that inflammation happening, and oftentimes there are correlates with digestive system. Fungal infections are things like tinnias or athlete's foot jock itch, that sort of thing, and or reproductive system infections, yeast infections, those kinds of things. And they have fungal ties and oftentimes overgrowth of fungals like Candida, for example, in the digestive system. We'll get into the specifics of that in just a little bit. And then with respect to mental health, remember I said there's a lot of direct correlates between nervous system and neurotransmitters and also what's going on with respect to the chemistry in the gut. So I see a lot of learning challenged kids in my practice, and a lot of their mental health concerns come from the fact that their digestive systems are unhappy, be it inflammation at the level of the gut that's spilling out into their bloodstream and moving into the nervous system and into the brain, and or the challenges from moods related to diarrhea or constipation, the pain involved from constipation, all of these kinds of things really do affect their moods and obviously their ability to learn and retain information. So a couple of products with respect to looking at GI health. So with respect to DGL, this is a deglycerized licorice. It's very helpful with respect to H. pylori infections or Helicobacter pylori, which is the principal microbe involved in ulcers in the upper digestive tract. With respect to this product, it helps with stimulating the normal defense systems at the level of the stomach and creating healthy gut mucosa. With respect to antacid medications, really what that's doing is limiting the amount of acid production. It's not really doing anything to facilitate healing or healthy tissues. And while there can be a time and a place for antacid medications, it doesn't do your system a service long term. And the reason being is that because when acid production is low, microbial growth in the stomach is high, because acid is a natural antimicrobial. It basically torches the bugs, for lack of a better analogy. And so when that antacid is used, the stomach acid lowers and microbes often grow as a result. Also with respect to low stomach acid, it really compromises the rest of the digestive cascade. Optimum levels of stomach acid trigger downstream release of digestive enzymes from the pancreas, as well as bile secretion from the gallbladder. So again, when stomach acid levels are low, the downstream digestive chemistry is impacted, and that's not something we want long-term either. The other thing I want to talk about with respect to DGL, and specifically with respect to licorice, licorice root is a really great adaptogen as well, and I didn't get to that in the upper part of the talk here with respect to adaptogens. It's really great at helping to modulate the stress hormones, and particularly cortisol, that chronic stress hormone. So again, thinking about that from a nervous system perspective. Mastic gum, again, really great for helping with healing of ulcers, and that H. pylori microbe, helping to repair the stomach wall. A really, really sort of ancient remedy, and one that comes from the Greek islands, but one that's been used for a long time with good clinical results. The Gastro Relief Formula is basically a combination of these as well as some other additions. With respect to the potassium nitrate in this formula, that helps with increasing nitric oxide. And nitric oxide is something that sounds quite sinister, but actually is very important in the body. It really helps with circulation and blood flow and healing up tissues. This one also will help facilitate lowering levels of that H. pylori microbe and helping with ulcers. The zinc carnosine in this product will also help with the gastric mucosal integrity and has some anti-ulcerative properties. Zinc is also very important in proper formulation of stomach acid, so remembering that. It has the mastic gum in here as well, and we alluded to that in the previous slide. And another component called alginic acid, which is a very interesting addition to this formula. It helps with prevention of reflux or heartburn. It helps to coat the esophagus as a preventable, but also helps with, if there is some backsplash up into the esophagus, it helps to facilitate coating that area so there isn't any damage, and really helpful, and it's shown sort of to be as effective or more effective than some of the common drugs used for lowering stomach acid and heartburn conditions. Oftentimes with respect to heartburn, it's not a challenge with too much stomach acid production. It's actually a challenge with that valve between the esophagus and the stomach, and that's really where the attention needs to be with respect to helping to facilitate getting the heartburn condition under control. Next one here, the Triflex 750. This is a combination Ayurvedic medicine formula, really great at helping with detoxification, but also helpful with increasing bile production. Bile is coming from the gallbladder and is a natural peristaltic or gut mover, as well as being helpful with detoxification. Often I use this one with elderly folks. As we age and often as we get into our senior years, our digestive system with respect to the peristalsis, how well the guts move, slows down, and the ability to sort of keep constipation is, as I guess what I'm saying here, it tends to be very common in the elderly, and this helps to facilitate keeping things moving, keeping the mucus secretions adequate, lowering the inflammatory load, just promoting bowel regularity. So again, a very common thing that happens with aging and the elderly, and this formula really works well at facilitating keeping the bowels moving. And then moving on to fiber. Fiber, again, very important in promoting bowel regularity. With respect to dietary fiber, lots of research out showing that commonly in North American culture and diets, and with respect to the standard American diet, or what's known as the SAD diet, we don't get enough dietary fiber. Dietary fiber is coming from our fresh fruits and vegetables, from our whole grains, these kinds of places. And often with fast food diets and eating on the go, we just don't get enough roughage in our diets to facilitate good dietary fiber levels. So helping to make good bowel regularity, helping to promote growth of the healthy bacteria, helpful for also balancing and helping to facilitate healthy immune system, as well as helping to balance blood sugar and cholesterol in addition. So win-win-win down the line here with respect to fiber and incorporating fiber into our diets. So moving on here, I want to talk now about food allergies. And food allergies is something that I deal with, again, almost on a daily basis in my practice. And food allergies can be a real key to the kingdom with respect to why your guts may not be happy. It's a real common thing that tends to not get addressed that well conventionally. So with respect to food allergy types, there are two main types that tend to occur. The first one is what's called an IgE allergy. IgE is basically the quick allergy. It's the, oh my goodness, where is the EpiPen reaction? It's an allergy that's happening very quickly. It's happening and often is serious. Individuals can break out in hives. They can have breathing challenges. They can have issues where they're instantly nauseous. Things are happening quickly and are quite severe. The common foods for this are things like peanuts, seafood, shellfish, strawberries, for example, are ones that people have these reactions to. Another common word used with IgE allergies are anaphylactic reactions. So again, they're happening very quickly. There's another type of allergy, and this is the one that I do a lot of work in and see a lot of correlates with respect to digestive system challenges, and this is what's called an IgG allergy. These are what are called delayed food allergies, and these allergies are not quick. They happen over hours or days, and they're a lot more mysterious. They tend to cause low-grade inflammation in the digestive system and also potentially low-grade inflammation in other systems of the body. They can affect many areas. So I've seen issues with IgG or these delayed allergies causing low-grade inflammation in the respiratory system, for example, or inflammation at the level of the skin, which we talked about, or challenges with pains in the joints, for example. It can really affect lots of different areas of the body. Common foods are the common foods that tend to be in our North American diets. They are dairy products, wheat products, eggs, and soy. So with respect to this delayed food allergy reaction, I just want to get into it a little bit more with respect to how it works. So what happens is that the IgG is actually an antibody, and it's part of our immune system, and it's circulating in our digestive system. What happens is when the food is digested poorly, and it's usually undigested protein, when that's absorbed through the intestinal wall, this antibody is part of the immune system. It reacts, and it's kind of like a lock and key reaction. So you can think of it, the antigen is the undigested food chemical, the antibody sort of like a lock and key, and that's creating an inflammatory cascade at the level of the immune system, and then those inflammatory chemicals spill out to many areas of the body. So when that reaction first happens, there's sort of more of a subtler delayed reaction, but that reaction can then, as the immune system tags this food item as an offending sort of, when the immune system tags this food item, and then with subsequent food introductions, this reaction can snowball. It can escalate. It can elevate. So people can sort of have challenges for on a lower grade level for extended periods of time, but ultimately then it can snowball and become much more challenging and compromising to their digestive system and other systems in their body. With respect to food allergy testing, there are sort of two common ways of testing food allergies. Normally, if you go to an allergist or an immunologist, you get what's called a scratch test, and that is a measurement of the IgE or the immediate reaction to foods. And what happens with that test is that a small amount of that allergenic substance is placed underneath the surface of the skin and then watched and monitored for reaction, basically to watch and see if that item will form a hive. And so with respect to that, obviously if that comes up, then there is some immediate or IgE-related reaction there, and that's a serious thing that needs to be dealt with and obviously reminded about to the rest of the family and or if it's children with respect to school settings, those kinds of things. And often these individuals will carry EpiPens for those reactions. With respect to IgG allergies, delayed food allergies, these aren't going to show up on a conventional scratch test because they take a lot of time to react. It is this delayed reaction. So it takes some hours, it can take some days. So a scratch test will not show a delayed food reaction. You need to look in the bloodstream for the chemistry for the immune system reaction. So oftentimes people will say, I thought I had food allergies, but I went and I had a scratch test and nothing came up. And it was because the IgE test was performed, and what the individual was suffering from was the delayed food allergy, and it just wasn't measured adequately to show the level of allergy. So with respect to delayed allergies, if you have this testing done and it shows that you do have challenges to food in the delayed form, what I often say to patients is to incorporate what's called the 4R method. So the 4R method is looking at these 4 items. First of all, we want to remove those offending foods, and we want to remove those offending foods obviously because it's creating inflammation and it's compromising digestive health. We want to rotate the existing foods in the diet. So oftentimes when allergenic foods or problem foods are taken out of the diet, we tend to hone in on eating larger amounts of other foods in our diet, and sometimes because our guts aren't in a healthy place yet, we can develop allergies to those foods. So we want to rotate the existing foods in the diet to prevent the potential for that. Then obviously we want to work to repair the gut, to repair the digestive integrity. We want to use things like probiotics, enzymes, and an amino acid called glutamine, and I'll get into the specifics of all of these in just a minute. And then down the line, we want to reintroduce those offending foods. Oftentimes, the timeline around that, it can really vary from individual to individual, but sort of a period of approximately 4 to 6 months for a significant IgG allergy can be sort of a time frame for helping to restore the integrity of the gut and calm the immune system down and its reactivity to that offending food. Oftentimes then reintroducing the offending food and just sort of monitoring the patient clinically will show whether or not challenges are still there and additional time needs to be taken away from that food. Okay. So actually, let me just go back just for a second. So with respect to delayed food allergies, I just want to talk a little bit about wheat and dairy. I see a lot of learning challenged kids in my practice, a lot of kids on the autistic spectrum, and there's a lot of research around showing that these kids do have challenges with wheat and dairy, and specifically the proteins of wheat and dairy, which are gluten and casein. And so just remembering that these are really common challenges with respect to kids, and what happens is that when these wheat and dairy proteins aren't broken down properly, they create other chemicals in the body, in the bloodstream, that get up into the nervous system and the brain, and those can really cause roadblocks in what the brain is trying to execute on a daily basis. So I just wanted to plant that seed with you as well, that there's a really high correlates with respect to learning challenged kids and issues with dairy and wheat allergies particularly. So moving on to sort of the repair part of that 4R method here, looking at probiotics, and probiotics very important with respect to the repair processes of the gut. Probiotics discovered in the early 1900s, a couple of definitions here for you to look at, but basically these are the good bugs in our guts. These are the ones that help to maintain a proper microbial balance and really are doing 3 main things, which are helping with balancing good versus not so good bacteria in the gut, helping with digesting properly the foods that are being eaten, and lowering allergenic potential. So yeah, just with respect to that, a couple of other things, so really helpful with balancing the immune system. Because they're doing those 3 main things I just talked about, they're lowering the inflammatory response, or helping to facilitate a normal inflammatory response. With the good bacteria in and hopefully the bad bacteria out, we're preventing infections, and we're lowering the likelihood of allergies because things are getting digested properly. So a couple of bullet points here on mechanisms of action, really helpful with respect to all of the cellular signaling in the inflammatory pathways, and even help from a genetic level to upregulate the genes that make healthy gut cells and facilitate all aspects of digestion, from absorption to metabolism to proper mucosal barriers, and proper growth of all the healthy gut cells. So really, really important in lots of ways, from sort of the larger ways of balancing and lowering inflammation right down to things happening at a genetic level. So looking at a couple of probiotic formulas that I like to use, the advanced biotics formula, really great at helping with all of the things we just talked about, and specifically drawing your attention to a couple of the particular strains in this formula. The LKC strain, really helpful with Candida. Candida is an opportunistic yeast that we haven't talked about yet, and I want to draw your attention to that. So it's often one that comes along after antibiotics are used. So antibiotics are often used conventionally, and very important for infections. There's certainly a time and a place for antibiotics. Lots of media and articles out there about that our society in general has been overprescribed antibiotics to our detriment, but certainly there is a time and a place for antibiotics, and they're very good at managing infections. The issue with them, though, is that they're sort of more like a blowtorch. They take away the bad guys that are causing the infection, but they also take away the good guys. And one of the things that happens when the good guys are taken away is that Candida steps in and grows and starts to bloom in amounts that are larger than should be, and that can cause challenges in our bodies. Women often know this when they get the side effects in the form of yeast infection, for example, in their reproductive areas. So this probiotic, and specifically with this strain of KC, really helping with Candida formulation. The other things we talked about, healthy formulation of other good bacteria, removing pathogenic bacteria. Another strain here, the L. gasseri strain, which isn't on this slide, also helpful with lowering levels of Staph aureus. Staph infections in the gut are very rare. They often happen on the surface of the skin, but the body is an ecosystem, and so we want to make sure that the bacteria levels are balanced in the gut, obviously, but also in other areas of the body as well. And Staph aureus is the one that causes flesh-eating disease or other staph infections, impetigo and those sorts of things. So we really want to, again, make sure that that bacteria is kept in check, and these probiotics help to facilitate that. The probiotic 3 formula is just a little bit different formula. It's got 3 strains in it only, but very helpful, very synergistic, helping to reduce allergies, helping with immunity, helping with symptoms of bloating, helping with challenges with diarrhea, antibiotic fallout, detoxification, really win-win again across the board here. Very helpful together in combination here. Moving on to enzymes here, and enzymes have a very important role, again, in that repair mechanism of the gut. The enzymes normally that we have in our body are secreted by the organ called the pancreas, which we didn't get into specifically, but they are the chemicals that come out in the second part of the digestive process and help to break the food down into small, usable bits for our nutrients to be absorbed into the tissues throughout the body. So one of the formulas that I use a lot with individuals is one called DPP-zyme, and DPP-4 enzyme is one that's specifically related to challenges with food allergies, and specifically challenges with gluten and casein, those wheat and dairy proteins. So this really helps to facilitate getting that enzyme level up in the body and helping to break down those food items. Interestingly enough, it's been shown in research that children on the autistic spectrum have actually a genetic deficiency in producing this specific DPP-4 enzyme, and so that can be one of the reasons why they are challenged with gluten and casein or wheat and dairy from an allergenic potential. So this really helps to facilitate getting that good chemical enzyme back in their system and breaking down those food items properly. Also helps to benefit those with autoimmune disease. And autoimmune disease is basically when the body cannot recognize anymore what is friend and what is foe. So the immune system turns on the healthy tissues of the body and starts to attack. And oftentimes, the root of autoimmune disease can be in the gut and can be from an allergenic or inflamed gut that's gone on for many years. So conditions like rheumatoid arthritis, lupus, where there is an autoimmune, basically an autoimmune reaction going on, can also have roots in gut challenges and low enzyme levels. So it's important to think about that when you're thinking about autoimmune disease. A couple of other formulas here, the AOR-Zyme formula, a full-spectrum enzyme, full spectrum meaning that it's providing enzymes for digestion of proteins and carbs and fats. This one uses the glandular extracts of enzymes, which can be a little bit stronger sometimes for individuals. So remembering that if you're needing more of a stronger formula. The Digest A's is a vegetarian form, but still a good, effective, broad-spectrum digestive enzyme. But again, not with the glandulars in there. And again, really, I want to draw your attention to the fact that enzymes in general can also be anti-inflammatory. And so a lot of individuals with inflamed conditions, athletes, for example, with inflamed conditions from workouts or their events, tend to have better recovery times when using enzymes because of their anti-inflammatory effect. So just being aware of that benefit as well. Moving on to L-glutamine. L-glutamine being an amino acid, very important in helping with formation of healthy gut cells, specifically in the level of the small intestine, and that helps with proper, obviously proper integrity, proper digestion, lowering challenges with immune system, lowering allergenic challenges, and specifically helping with all levels of the immune system to help fight microbes, bacteria, and viruses. Also, glutathione is one of the building blocks in the major antioxidant in the body called glutathione. Glutathione being a major, basically a major antioxidant or key detoxifier in dealing with inflammatory chemicals, challenges with chemicals from our environment, and sort of all levels of our exposure in the world. So very important there, and a great benefit from taking a glutamine supplement. In addition, wanted to draw your attention to the last bullet there. With high cortisol levels or high stress levels, our glutamine levels will start to drop. So again, when when stress is high, gut function is low, and again, one of the other reasons being is that the glutamine levels can deplete with the high cortisol levels, and that impairs the gut health and impairs the digestive system and the immune system. So moving on here, wanting to talk about some GI bugs or microbes. A couple of them we've talked about already, but just want to talk about some specific other ones as well. With respect to testing for these, H. pylori, that microbe that causes ulcers in the gut, often done with a breath test. So patients are providing a breath sample, and they're measuring the levels of off-gassing in the breath for the H. pylori microbe, but as well it can be measured in conventional laboratory tests. With respect to looking for other microbes in the stool, often people will get what's called O and P tests or stool samples, so measuring the levels of microbes in the stool. With respect to parasites, it can be a bit hit and miss depending on where the parasite is in its life cycle. So sometimes people will have parasitic infections. They'll go for a stool test or an O and P test, and it comes back negative, and they don't think they have a parasite, but it just wasn't caught at the right cycle of the life of the parasite, and so it gave sort of a false negative. So again, remembering that they can be a bit hit and miss, and if you think if you've been away traveling into sort of third world areas or other areas, you think you've contracted something, you have a negative parasite stool test, O and P test, you may want to think, and you're still having symptoms, you may want to think about rechecking that or going for another way of measuring that. So another way of measuring that, and I don't have it on the slide here, but I want to draw your attention to, is something called a CDA test, which stands for Comprehensive Digestive Stool Analysis. So this is one that isn't often run through the conventional laboratories, but is available through naturopathic doctors' offices, and it's a much more in-depth analysis of what's going on at the level of the stool and the gut with respect to microbes. So just being aware of that, it tends to be a much more comprehensive screen of microbes in the stool. CDSA, or Comprehensive Digestive Stool Analysis. So probiotics, we talked about, again, being very good at balancing good versus not so good bacteria. I don't think I need to revisit that here. But again, just remembering, I can't stress it enough, the importance of having, if you're having digestive system challenges, probiotics are really a key component. So with respect to another one, and this is a probiotic of sorts, and one you're probably not necessarily familiar with, Saccharomyces boulardii is basically an opportunistic or a rogue yeast, and it goes after unsavory microbes or the bad guys, bug-wise, in our gut. Really helpful for treating symptoms of traveler's diarrhea, a really great thing to have in your first aid kits or your travel kits if you're heading out traveling in other foreign countries, having foods you're not normally eating. Also great at helping with antibiotic-associated diarrheas. So oftentimes, again, when the antibiotic is used to fight the infection, wiping out the bad guys and the good guys, the Saccharomyces helps to put those good guys back in there. And the principal thing that I use it for clinically is people that have Clostridium difficile or C. diff infections. This, again, is a nasty microbe that gets into the system, often from numerous rounds of antibiotics for treating infections. It just sort of sets up house in the guts and can really cause challenges with gut health and inflammation in the digestive system and beyond. So it really helps to facilitate getting rid of that C. diff Clostridium infection and balancing the good versus not so good bacteria in the gut. Helping to compete for the receptor sites so those bacteria don't bind and exert their effect, and also helping to boost the immune system. So remembering this one as an option, and also specifically remembering it for those that have C. diff or Clostridium infections. I guess I just want to, let me just back up just for a second. With respect to probiotics, people often ask, if I'm on antibiotics, should I be taking probiotics too? And there's a lot of different conflicting opinions out there. I'll share my opinion, and that opinion is, yes, I believe you should, in combination, take an antibiotic and a probiotic. Not at the same time as you're taking the antibiotic, but certainly throughout the course of the day. And so the reason being is because the antibiotic is taking the good bacteria along with the bad bacteria causing the infection, you want to put that good bacteria back in the system as early as possible, in my opinion. So a couple of other formulas that help with microbial infections, those bugs that get into our guts and beyond. Another one, olive leaf extract. Olive leaf, very helpful with helping fight bacteria and viruses and funguses. So sort of across the board, all of the microbes that we could encounter. The active ingredient in that is all-europene, and it's really great at facilitating getting the load of these microbes down in the system. Helping with levels of the immune system, those T helper cells, B cells, and macrophages, which are the ones specifically that go after neutralizing the bacteria and fighting viruses, as well as helping to prevent spread of infection. This Immunox formula is a relatively new formula with AOR, and one that is a combination, but the olive leaf is the active ingredient there. In addition, it helps to facilitate increasing nitric oxide production in combination with that. So again, remembering nitric oxide, very important for helping with circulation, helping with oxygenation, and that really helps to facilitate fighting infection and speed up healing. Another one here, garlic, an alkalized garlic formula with AOR. Garlic we often think of for use with helping with cardiovascular issues, challenges with cholesterol, for example, those sorts of things. But garlic is also a wonderful antimicrobial, really great at fighting E. coli and candida and parasitic infections, great at stimulating the immune system, really wonderful thing to think about in addition. And, you know, either taking it in this form, capsule form, which is an alkalized form, which doesn't make you stinky from a breath perspective, and or having it in your diet, just in a naturally occurring form, or straight up garlic can be very helpful in helping with microbes. So just remembering that. So bringing it all home here, tying it all together. If you have or know of individuals that have challenges with gastrointestinal health, you're interested in maintaining your gastrointestinal health long term, I would recommend the following here: a probiotic, which we talked about, balancing the good versus not so good bacteria, helping with optimum digestion, lowering allergenic potential. Enzymes, very helpful anti-inflammatories, helping with digesting the foods properly, facilitating optimal digestion of proteins, fats, and carbs. Fiber, promoting bowel regularity, helping with balancing blood sugar and cholesterol, helping to facilitate good bacterial growth in the gut. Curcumin I haven't talked about yet, and I'll get to in just a second. And then potentially an adaptogen. You may want to think about, if you're leading a go-go stressful lifestyle, you may want to think about incorporating an adaptogen, because as I've said in the past in the talk here, when stress is high, gut function is low. And you may want to use an adaptogen to help facilitate balancing your stress, leveling out that teeter-totter to ensure that your gut health is happy long term. So curcumin. Curcumin, lots of great, oops, sorry, I went the wrong way. Curcumin, lots of great curcumin formulas with AOR. The CurcuViva formula here, a really high bioavailability of curcumin, a good strong dose of it. Curcumin really I'm thinking about here as a natural anti-inflammatory, so helping to lower the level of inflammation in the gut, a wonderful antioxidant, helping to clean up and cleanse both at the level of the gut and the bloodstream and beyond. And also, if you've been reading either on the AOR website, Facebook page, or even in the media, curcumin is now been shown in research to help facilitate balanced blood sugar, which we didn't get into specifically today, but rampant challenges with people in dire straits with abnormal blood sugar levels, pre-diabetic or diabetic conditions, both in children and in adults alike. So again, helpful for facilitating balances in blood sugar. So with respect to the talk, that brings me to the conclusion here. I hope it's been informational. I hope it's been useful for you. With respect to questions, you can post your questions, as Susan alluded to, and the team will facilitate getting answers to you at the time just after the talk here and beyond. I want to thank you all very much for taking time to be with me today, and I look forward to future webinars. I hope you found this useful, and I wish you all a great day. Thank you very much.